You're listening to Plants and Politics with Gina Bonanno-Lemos. If you're ready to hear the truth about both sides of the aisle, what's really going on in America, and how big money interests prevent change to keep you sick, broke, and desperate, then play on. Everyone, welcome to Plants and Politics. This is Gina. So there's some not so great news on the COVID front. NPR reports that on Sunday, July 19th, the U.S. Navy deployed 5 medical teams to support healthcare workers in South Texas. In the past week alone, Texas has had 10,000 new cases per day. Not total in the past week, per day. That's a 55% increase since the beginning of this month, the beginning of July. So they spoke with Dr. Jamil Mahdi, I believe is how you say his name. He's the chief of the critical care at Valley Baptist Medical Center in Harlingen, Texas. He told APR that the intensive care unit went from only a few patients a month ago to 95% of current beds filled. He also said they've exceeded, and this is a quote, exceeded the units traditionally used for the ICU. And he said that they've been forced to create, quote, makeshift units all over the hospital. And that approximately 75% of all of the total amount of people in the hospital are COVID patients. So this is getting insane. This is really getting insane. When asked about the profile of the patients who are being admitted, Dr. Mahdi said that a few months ago, the majority were elderly, but now they're seeing patients in all age groups ranging from their 20s all the way up to their 60s. And he said that some have one comorbid factor, such as hypertension or diabetes, but some have no other health issues. So I question this, and I'll explain why in a moment. Dr. Mahdi went on to say that, quote, invariably, though, a large percentage of them have obesity. But remember, our population in that area is mostly obese. So this is my issue. Most people in America are completely unaware of health issues that they have, either because they just don't go to the doctor or they're just used to feeling like crap, so they don't think anything of it when another symptom pops up. And doctors will tell you that often the first sign of cardiovascular disease is a fatal heart attack or stroke, right? People have no idea that they have blocked arteries until they have a fatal event. And cardiovascular disease is the number one cause of death in our country. So if people are obese, they unquestionably have health issues. The absence of a diagnosis doesn't equal the absence of disease. It's not the same thing. I would be willing to bet money on the fact that the majority of these patients are either pre-diabetic or they have undiagnosed type 2 diabetes. They could also be suffering from metabolic syndrome, which means that you have a multitude of health conditions that increase your risk for a cardiovascular event like a heart attack or stroke, or of developing type 2 diabetes. So my point is this: we really need to retrain doctors in this country. And we need to reassess and reconsider the language and the metrics we use in describing and determining a person's health status. And I don't say this to be mean or judgmental, but to actually help and protect people. Because I think that traditional medical doctors, in large part, are doing a great disservice to the public by giving them the impression that it's quote unquote healthy, or that you don't have a medical condition when you're obese, or that simply because you don't have something that's been officially diagnosed yet, it means that you don't have a disease. Because then you have a large part of the population walking around thinking that they're healthy, that they have no issues. Nothing needs to change. And we know from statistics, we know from reporting that people who have these comorbidity factors, meaning that they have another health issue in addition to the COVID, it not only puts them more at risk of succumbing to COVID, of actually being diagnosed and getting the virus, but of becoming gravely ill from it and even dying from it. So I think we need to take this time. I think this is a moment in time that we can seize and make this a great opportunity to let people know about prevention and let people know that, yeah, if you are obese, you have these things going on. You may not have gone to the doctor, most likely because you lost your job and you lost your health insurance due to no fault of your own, due to our country, our government's failures. I mean, part of it was the virus, but part of it is just simply because we refuse to give people Medicare for all, but we can go bail out Wall Street. It's insane to me. It's like literally blows my mind that we have people who will die from things like this, who are not given proper education, proper treatment. They have no health insurance, but we can bail out frickin' Wall Street. All the bankers are fine. All the people who are invested in Wall Street are fine. All these corporations are great. We got people like Jeff Bezos of Amazon, a billionaire, not paying a dime in federal freaking taxes. But we have people who can't go to the doctor because they literally can't afford it. This is insane. We are going to be judged so harshly in the future, it's not even funny. They're going to look at us like, who are these primitive beasts? Who are these idiots? It just is, God, if every other industrialized country can figure it out, we can frickin' figure it out in the United States of America. We just don't want to. The people want to, but the people in power don't. Anyway, guys, that is my rant about this. I am just worried about people. I'm worried about their health. They need to be told the truth. And doctors, for God's sakes, need to be educated better on what is actually health and healthy, and how food and exercise and other lifestyle factors play a role and affect us on an epigenetic level. Because right now, they're just clueless. The majority of them, the ones that are traditionally trained, who refuse to go outside of their comfort zone, who refuse to learn anything that wasn't taught to them in these medical schools that were bought and paid for by the wealthy to sell their freaking drugs. Oh, God, it just drives me insane. As always, like, share, subscribe, all that good stuff. Ring the bell on YouTube so you'll be notified of new videos, and I will talk to you guys soon. Take care. Thanks for listening to Plants and Politics. The only way we can take our country and power back is to spread the truth and build an army. So remember to like, follow, subscribe, and share on Facebook, YouTube, and wherever you listen to your podcasts. Thanks again.